This structure right here, the trachea. On either side of the trachea we have the jugular veins. So here's the left jugular vein, here's the right jugular vein. This is the esophagus. The esophagus is really big because, you know, I'm sure you've all seen pictures of like snakes eating eggs and having so their esophagus is really elastic. It's really large and elastic. This here is the anterior azygos vein.
Okay.
So we have the two jugular veins and the anterior azygos vein right there. Okay. Esophagus, we go down here. Here we have the heart, right? And we've got the ventricle and then the two, oh, why is their name escaping me?
Here we go.
Where'd you get the auricles? This is on Learn. Yeah, the whole snake thing is on Learn. And we have the two auricles. So ventricle and the two auricles of the heart.
Okay.
Right. And the heart has, there are two superior vena cava in the heart. There's the right superior vena cava. The right superior vena cava has two branches. So we have the external jugular and the anterior azygos combined to form the right superior vena cava. And the left jugular becomes the left superior vena cava as it goes into the heart.
Okay.
All right. So there's two superior vena cavas in the snake.
So it connects to the heart.
Yeah, and they go into the heart. Yep. And so then if we sort of move the heart back, you can see the normal azygos. So there's the anterior azygos and there's the azygos, just plain azygos. And that goes back into, that's this little vessel going back into the wall here.
Okay.
Does that make sense?
Yeah, azygos.
Yeah. And then there's also so there's the inferior vena cava, which comes down like this behind the heart. And there's also the pulmonary vein, which is the one going right into the lung. So this structure right here, this is the lung. Snakes only have one lung.
That makes sense.
So you have there. Yep, and the pulmonary just goes right into the lung. All right?
Yes.
So that's all the hard part about the snake. And then here are the posterior vena cava.
Were they just the external jugular? What did you say?
Yeah, they're just jugular veins.
Okay, both just jugular.
Yeah. And then, so lung, we have liver. Down here, this is the stomach. So you can see this pouch, how the esophagus enlarges into this pouch, and that's the stomach. And then, so you have a big long stomach that becomes the intestines down here. All right, so here we have the liver. Here's the gallbladder, this little green thing. Gallbladder is always green. And then immediately on the other side, we have the pancreas, which is the light portion, and the spleen, which is the dark portion on top. And they're both very small, right? You can see that. Pancreas, spleen.
Yeah.
And so we keep going down. And this is a female snake. So here are the ovaries. These structures right here, they look like little beads next to the intestines. And we go down even farther. And we have the kidneys. So here's the left kidney. And then on the other side, we have the right kidney.
So if there's a male snake, would the testes be in the same position as the ovaries?
No, a male snake looks totally different. We're not going to ask you about it. Male snakes have hemipenes and things like that.
One quick question. I was wondering how to make the dissection for the eye. Like,
It says
they say the dorsal back portion. Are we just like,
no, you want to cut it through like that.
like that down the middle?
I'm trying to
Because
remember.
it was like 1/3 of the dorsals. And something we were kind of confused.
Yeah, I'm pretty sure you want to cut it through like this on the top so that you can look down into it and see the lens and everything.
Oh, okay.
Because if you just cut off the back, you're going to just cut off the entire retina.
Right.
Does that make sense?
So just cut
So you
straight.
want to cut across like the top right through here.
And it says like 1/3. So should we just like cut off?
You don't want
like,
to cut right in half because then again you'll cut through the lens if you do that.
Oh, okay. Got it. Thank you.
That makes sense? Yeah.
And what is this? Like, is this anything important, this green thing?
No, this is just the colon. It's got
it is.
stuff in it.
Okay.
So it
The
comes.
green is snake poop.
Alright.
Oh, that's what it is.
Can I figure out those lobes of the liver?
Gotcha.
Yeah. Hang on, Lauren has a question. She's had her hand up for a little while, and then I'll